Hello?
Hello, my name is Anthony. I'm a Harvard College nursing student. I'm here to do a physical assessment. Is that okay with you?
Yes, yes.
Alright, so I'll ask you a few questions to begin. Do you know who the President of the United States is?
Yes.
Who is that?
Donald Trump.
Do you know what season this is?
Yes. Spring.
Do you know where you are?
Yeah. I'm at home.
Good. And then the last question is, do you know why you're here?
I'm getting assessed for my physical.
Good. So another few questions is check your cognitive function. Do you know what 2 plus 2 is?
4.
And what's 5 plus 5?
10.
So, from what I can see, that you're alert and awake, learning to times 4 as well. You're not falling asleep on me. Your speech and communication is clear and concise. And I also just want to check your skin temperature. So I'm just gonna rub my hands, and it feels nice and warm. At this point, I would calculate your height and weight, and then your BMI. I would also be doing the Snellen chart with you to test out cranial nerve number 2, and finally I would take your vitals: blood pressure, pulse, respiration, and temperature. So the next thing I'm gonna do is I'm just gonna look at your head. So I would put on gloves, looking at shape and size. Shape, rounded and regular, and size, it's not abnormally large or small for the body. Then I would feel your hair in your head. So feeling your hair, nice and thin. Do you feel any pressure?
No.
Is it painful?
No.
So I don't feel any bumps or tenderness. And then I'm gonna feel for the frontal sinus. So take your glasses off. Is there any pain?
No.
Now I'm gonna do the maxilla sinus. You feel any pain?
No.
Okay, good. So there and there. Then I'm gonna feel for a temporal mandibular joint. So go ahead and open your mouth and close it. Do it again. Is there any pain?
No.
Good. And then lastly, we're gonna check for symmetry of the face. So actually, let me tilt it this way. So I'm looking at your eyebrows, eyes, nose, and mouth. They look nice and symmetrical. Can you smile? Can you frown? Can you raise your eyebrows? Lower them. So that's testing for cranial nerve number 7, NUR abnormalities found. And then we're going to check the eyes now. So if you look at me, just follow this pen. I'm testing for the 6 cardinal gazes of days. So that's for cranial nerve number 3, 4, and 6, which is good. Then I'm going to measure your pupils. So they look like a 4 or 5 right now. Just look at me, and I should see a constriction. Yep. And they went down 1 or 2, which is good. Then we're going to test for accommodation. So follow this pen. So they move inward and they constricted. So that's his eyes are perla, pupils are equal, round, reactive to light, and accommodation. And finally, with the eyes, we're going to look at the conjunctiva and the sclera. So I'm just going to pull this down and look up. Good. And the sclera is white. So there's no abnormality color with the conjunctiva on the left. Do it again. Look up. No abnormalities on the conjunctiva of the right eye, and the sclera is white. Next, we're going to go into the ears. So with the ears, I'm just going to inspect and palpate. So I'm looking, no, not red, no cuts or bruises, a little bit of earwax. Alright, do you feel any tenderness?
I do not.
Good. Now we're going to go with the other ear. I'm looking, no redness, no cuts, bruising, or swelling, a little bit of earwax, and then I'm going to feel for again. Any tenderness?
No.
Good. So now I'm going to test cranial nerve number 8, and to do so, it's a whisper test. You can put your glasses. So I'm going to whisper on your left ear and your right ear, and you tell me what it is.
Red.
Good.
Black.
Good. So that's good. That's in hearing is intact. Next thing is the nose. So I'm looking at the nose. Alright, looks good. Then I'm going to check the nasal septum. It's not deviated. Actually, so the camera can see. Tilt the chair this way. No, other way. good. No discoloration of the nose or any signs of cuts or bruises. Now I'm gonna feel for your nose. Any pain or tenderness?
No.
Good. We're gonna test the patency of it. So close one nostril and then breathe out. Do the other way. So it looks like his left nostril is a little bit more pain than his right. Next we're gonna check is his mouth. So as I'm looking at the mouth, the lips are nice and pink, not cracked lips, which is good. If you open your mouth, looking at the buccal mucosa, nice and pink, shiny. His teeth are white, a little yellow, which is good. Looking at the gums, gums are good, they're not inflamed. What else we can check? The tongue, say ah.
Ah.
As he was saying that, I'm looking at cranial nerve number 9 and 10. The hard palate and from the soft palate and the uvula, that they're moving, which they were. Stick out your tongue. Cranial nerve number 12, it's in midline, so it's good. It's bumpy and rough, which is also good. To have your tongue reach the roof of your mouth. And ah. So basically I'm just looking underneath it. Pink and smooth, which is good. No abnormal growth in the bottom. And finally, let's look at the hard palate. So there's a separation of hard and soft palate. The uvula, the last thing I gotta check. So I can see the uvula and his tonsils doesn't look to be growing toward each other, which is good. Next, we're gonna look at the neck. I'm gonna feel for a few things. Parotid, salivary, and the thyroid. So I didn't feel any lumps or bumps, which is good. Do you feel any tenderness?
No.
Alright. Now we're gonna also feel for the other glands. Preauricular, postauricular, occipital, submental, submandibular, jugular-didastic, superficial cervical chain, deep cervical chain, and then bring your chin to your neck. We're going to look for the posterior occipital chain, and then finally the supraclavicular area, so right underneath here. If you can shrug your shoulders up, like that. Actually, no, like that. There you go. Any tenderness or pain in anywhere?
Nope.
Good. Alright, now we're going to test the range of motion of your neck. Push to your left. Good. Push to your right. Take your left ear to your left shoulder. Other way. So that's testing cranial nerve. And then shrug your shoulders up. Alright. That's testing for cranial nerve number 11. Finally, another thing we do in the neck is palpate for the jugular vein. So it's strong and regular. Strong and regular. Now I'm gonna listen to it. Using the bow of my stethoscope. Alright, I didn't hear anything, which is good, no murmurs or bruise. Another thing I want to test for is we're going to go now to your arms. So if you can stick your arms up. So with the skin color again, skin temperature, nice and warm. The color, tan, no abnormal colors like red or blue. Then we're going to test your pulse. Right, strong and regular. Flip your hands over. Capillary refill, less than 3 seconds, which is good. We're going to test the strength and sensation So if you could, squeeze my fingers as hard as you can. Good. Let go. Now put your fingers up, down, in circle. And now with the elbows, I want you to bend your bicep. Go back. Now the other one. And back. With shoulders, if you can just rotate one arm, and then the other way. Good. We're gonna check for profile signs. So I'm gonna take your hand. The angle of the finger should be less than 160, which it is. Now with the other hand. Yep, that is. So next we're gonna do the chest. So I'm looking at his rate, rhythm, and depth of breathing. Rate doesn't seem to be too fast or slow. He's breathing without ease, it looks like. And are you having trouble breathing?
No, not at all.
Okay. And his quality looks to be good. You want to take your shirt off? Okay, so now we're going to listen to your lung sounds. Take a deep breath in and out. Good. Alright, if you want, you can pick up your left arm. Good. If you want, you can take just an inch forward in your seat. And I'm going to listen to the posterior. Actually, let's turn your chair this way so it ends. So posterior. And finally. Okay, that was posterior, and finally the right side. If you can pick your right arm up. Alright, so I heard clear lung sounds in all fields. Alright, if you want, you can turn back the other way. So no wheezing or bronchi, and then I heard 3 different types of lung sounds. Bronchovesicular in the middle right here. Bronchial sounds there. Bronchovesicular a little more outward, and the same thing posterior. And then vesicular sounds in the peripheries of both anterior and posterior sides. I did not see you use any accessory muscles like your shoulders and diaphragm, a little bit lower abdomen muscles. Next we're going to listen to is apical sounds. Since we're not in the bed, I would have laid you flat. We'll lay you and the head of the bed elevate to at least 30 to 45 degrees, and then we measure for or look for obvious signs of JVD. But right now we're going to listen to apical sounds. So I'm going to listen to your pulse. I'm going to listen to the rhythm and the pulse. So it would have been after 60 seconds. I would have gave you a rhythm, a pulse, and the quality, strong and regular. Next, I'm going to listen to the sounds using the bell of my stethoscope. Aortic, palmatic, tricuspid, and mitral. I'm going to do the same thing again with the diaphragm of my stethoscope. And I didn't hear, S1 and S2 sounds were regular. I didn't hear any murmurs or breweries. Next thing we're going to go into is the abdomen. If you can you lay flat? So maybe go a little bit more back. Because I think they can see toes. So I'm going to do that later. Alright, so looking at the abdomen, looking at the contour, looks round, the coloring, no bruises or cuts. It looks symmetrical from my point. They both rise at the same time. Next, I'm going to listen to his bowel sounds and using the diaphragm. Do you have any pain?
No.
Okay. So start with the right upper quadrant. Alright, I heard bowel sounds in all four quadrants. They're active. Then I'm going to go switch to the bell of my stethoscope and listen to the aortic sound. I didn't hear anything, which is good. Now we're going to move on to the renal arteries. So about an inch down and away. Alright, I didn't hear anything, which is a good thing. And then since he's laying down like this, we'll check lower extremities. Alright, so looking at his legs, the skin color looks normal, no abnormalities in there. We'll take your socks off. Pulses are strong and regular. Capillary refill, less than 3 seconds. Alright, that's good. No edema. Okay, so can you point your toes down? Good. Point them up toward you. Good. Which toe is this?
Thumb toe.
Good. Can you rotate your ankles? Good. So now testing strength of your feet. Of your knees. Can you pick 1 foot up? Bend at the knee. And I hold it up. Good. That's 5 seconds. Can you do that the other way? Good. Now we're gonna do hip. Testing out the hip. Move it out to the side like that. Good. Switch back to the other leg. Good. Alright, so next thing I want to do is neurological exam. You can go ahead and put your shirt on and then sit down. Okay, so we're going to ask you to do a few things. Okay, so can you touch your finger to your nose and then touch this? Good. Do it a few more times. Now can you take your thumb to your finger and just touch each one? Good. Now we're gonna do sharp and dull test. Sharp, dull. Alright, so close your eyes.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull.
Good. Next we would do, we're gonna do light touches, so close your eyes. And when you feel this, let me know.
I feel it. 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 Feel it.
Good. And then finally what we're gonna do is, shoot. Let me get another chair. No, I can't do this. Put your hand over this, like your whole forearm, and I'm going to test for reflexes. So go ahead and squeeze your bicep. Move your fingers. Good. Switch with the other hand. Good. Now I want you to start walking. So go from here and walk forward. And then when you turn around, walk heel to toe, like the drum test. Good, you can stop there. Alright, then close your eyes, and we're going to test your balance. Alright, 20 seconds passed. That's the Runberg challenge. Runberg test, I should say. Let's just put this here. Go ahead and sit down. Again, I need to test the patellar reflex. Okay, so it's legs up. Good. Good. And then finally you can stand up. We're going to do some spine and some spine stuff. Touch your toes. Looking at the curvature. Good. Now if you stand up, I'm feeling for it. Nice and curve. Curves up and then back. And then finally with your hips locked in place, move side to side. Alright. And that will conclude my physical assessment test.